where compliance is written, you have to provide marks based on your past experience. So you will more understand about the checklist. Like if I go through the checkpoint for notification, if you feel the ANM is notified the case regularly, you have to give marks accordingly. So the area of concern which is applicable to this checklist is notification, reporting, investigation, operation management, communication, conversion, quality management system. Which all the not area of concern is not applicable at the session site. One is causality assessment is not applicable. Then is monitoring and feedback. Okay. So it has a standard A1. The primary responsible notifying AEFI cases defined and communicated. So measurable element A1.1. Vaccinator is aware of category of AEFI. Based on experience, please give mark in the checklist. 0, 1 or 2. Based on your prior experience, not today. If I am filling the checklist 0, 1 and 2. Okay. I'll give you example. If I am filling this checklist, vaccinator is aware of category of AEFI. So when I visit the subcenter, I ask not exactly the same question, but I know the ANM is aware of AEFI cases. Which category they know. So based on the experience, I have given 0 marks for this, or 1 or 2. So my question is, we have written SI and PI in the assessment method. So we have to ask staff and the parent also. Why we are saying parent? Because during 4 key messages, the possible AEFI like fever will come. So parent should be aware of it. The next measurable element है person responsible for notifying the AEFI cases identified. So in this assessment method, we should ask the staff or we check the record. How we check the record? We have a SOP and the guideline also. So means of verification, it is ask staff regarding the responsibility for notifying the AEFI. The same question again, person responsible reporting the AEFI case. Both are different. Notification done by the medical officer, but we are just acting, filling because of our experience. So this will work as an internal assessment for you. So first measurable element is vaccinator is aware of category of AFI. So we should ask the staff and also we ask the parents if available. So why we ask the parents? We mostly say parents should aware what possible AFI should be. Next is person responsible for notifying of the AFI cases identified. For notifying the case, who is there for notifying the case? ANM, ASA, Anganwadi worker. Next is identified person is aware of the category of AEFI. So we should give marks, record review and the staff interview. Record review, we can check the SOP and also ask the staff. Next standard is there is established procedure routine for routine reporting of AEFI cases. Weekly reporting of AEFI cases ensured by ANM. So weekly reporting like where we report for minor cases and in the AEFI register. Okay. So only record review is there. Next is AEFI register is maintained at the block. So if AEFI register is maintained by the ANM, we should provide 2 marks. Weekly report of all serious and severe cases submitted to district immunization officer. So this will be checked by the weekly report, and AEFI cases reported in HMIs on monthly basis. So this can be checked through the record review and the staff interview. Next standard A3. There is an established process for immediate reporting of serious and severe AEFI cases. The service provider is aware of the AEFI event required to be immediately notified. So what are the event which is required to be immediately notified? We only notified serious and severe. Okay. In case of death in a hospital, and we immediate report. Okay. List of severe and serious AEFI case with definition available. So this will be available in the AEFI guideline. Also we have mentioned in the SOP. AEFI case reporting format, is it available at the session site? So CRF is available at the PSC and the session site also. Duly filled CRF is reported. So what is the timeline of reporting of CRF? 24 hours. And another 24 hours for reporting to district. So this can be answered through the record review and staff interview. But we'll check the record date. We have mentioned in the CRF also, date of notification. So key private facility providing immunization services are identified. So it may or may not available at all the PSC. Some PSCs are catering the urban area. So they have a private facility, but not all the facility have the private sector. Okay, private service provider have been effectively communicated. So do we tell private sector also to report the AEFI cases? Yes, we have the meeting with IM and IAP member for reporting of the AEFI cases. The same. Primary and secondary care hospital involved in reporting of AEFI cases. So this we can only ask through the staff interview. So here only staff interview is required. No record, nothing. So next is area of concern B, investigation. And then the area of concern D, operation management. So in B, investigation, there is only one standard. B2. Preliminary investigation of cases done as per guideline. Standard DC for operation management roles and responsibility for stakeholder. There are established procedure for training and capacity building. Immunization sites are prepared for preventing and treating any adverse event. Detail में we'll see. Area of concern B, investigation. Reporting medical officer prepare the list of evidences which will be required for investigation in consultation with the DIU. What are the list is required for investigation? In the means of verification, it is written there. Relevant register, NM diary, tally sheets and all. Okay. So we need to check this. Next is area of concern D, operation management, roles and responsibility of stakeholder at different administrative level. First major element is D 3.1. Frontline worker is aware of her roles and responsibility. So this all section is related to staff interview. First, for frontline worker, who are the frontline worker? ANM. Then is health supervisor, and then the medical officer. Then is standard D4. There are established procedure for training and capacity building. AEFI guidelines are available with the key stakeholder at all level. The AEFI guidelines are available at the PSC level. Training and skill need assessment. What should we do in this? Training and skill need assessment. How we do that? So, like we have in the morning, we have asked you to do the pre-test, and once the training is complete, we will ask you again for the post-test. So, this is a form of a training need assessment. How much you learn from the training. So, like that, you have prepared the training need assessment. Training has been provided to stakeholder as per schedule. We starting the year, we prepare the training calendar at the state level, at district level, at the PSC level also. We usually prepare the training calendar. Next, immunization sites are prepared for preventing and treating any adverse event following immunization. Here, parents are counseled for informing about any untoward event of concern following vaccine. So, for this measurable event, we only observe. Okay, antibiotic drugs are provided wherever required. So, what we give in antibiotic drug, paracetamol syrup or tablet. Now we give the syrup. So, we should observe, or we can ask to the parent. You can observe during the session visit. Next is drug tray is available with the site of immunization. So we have adrenal kit. So we can see by observation. Also there is a chart also we have prepared for doses, and also we provide expiry date in the written form, and the PSC medical officer certified this drug will be expiring that like that the same. Next is protocol and instruction regarding preventing. This also we have in the session site. So we only observe this. Vaccinator is aware of what to do in case of immediate serious reaction or anaphylaxis. So we can ask the staff only what to do in case of serious reaction. Vaccinator is aware of how to prevent immunization error. So what are the possible immunization error the ANM should know. Next area of concern is E, communication, and area of concern F, convergence. Standard E1 is there are established procedure for regular communication to build and maintain confidence in the community for the UIP program. And the standard E5, there are established processes for capacity building of key personnel responsible for communication for each level of administration. And the F5, there are established processes for coordination with the civil administration and law enforcement agencies. Details we'll see. First is there are established procedures for regular communication to build and maintain confidence in the UIP program. So for this measurable element, E1.1 is key personnel for community engagement have been identified. So PRI members, they are the key person. So we only need to as a staff interview. Vaccinator extension worker deliver the 4 key messages. So this question is purely on observation basis. Vaccinator and extension worker communicate the benefit of RI. Then is advocacy with key community influencer for giving key message. So we usually involve the community influencer. During IMI also we involve them. Whenever we do any campaign or mission in the rules, we usually ask them for community mobilization. Next is there are established procedures for capacity building of key personnel responsible communication at each level of administration. For this major element is E5.5, capacity building of social mobilization and advocacy is undertaken for community. What we do in this, verify by interacting with the volunteer. We also have some volunteers at the session in the village. Those are helping us into the mobilization of the beneficiary to the session site. Okay. Next is area of concern F, convergence. There are established procedure for coordination with the civil administration in case of crisis. So there is an established procedure for seeking help of civil administration in case of crisis. For this, I have shown this earlier photograph. They have mentioned all the person which is supporting in case of crisis at the session site. Okay, like that you have to prepare. Now last area of concern is H, quality management system. It has standard H1, H2, H3, S4 and 5, which is quality policy and objective, SOP, continuous quality improvement and the risk framework. So first is standard H1, quality policy and objective are defined and disseminated. So quality policy for AEFI surveillance program is defined. For this, observation, record review and staff interview is the method of assessment. Progress in achieving quality objectives is monitored periodically. So for this, I have given example of timeliness of the causality assessment. So like that, once the quality objective is achieved, you have to frame new objective. Next is standard operating procedure defined and documented and established at each level. SOP for key processes are prepared, approved, and updated. So staff is trained and aware of process written in SOP. Sometimes what happen, we have written so many things in the SOP, but staff is not aware about it. So the staff should be aware of the content in the SOP. There are established process for internal assessment, periodic reviews. Periodic internal assessment are conducted at various levels. What is the defined interval for internal assessment? Quarterly. Non-compliances are enumerated and recorded adequately. 0 and 1. These are the non-compliances. Action plan made on gaps found during the assessment process. The same. 0 and 1 you have to take out. Corrective action are taken to address the issue. So what are the gaps found? We have to take corrective action for that. And standard H4 continual quality improvement is practiced at each level of AEFI surveillance program. Action plans are prepared for the low performing area in the beneficiary stakeholder. Like that, I have shown that beneficiary stakeholder satisfaction survey. In that, we have to count low performing indicator attribute. Like if suppose ANM's behavior is not good towards the beneficiary, it will come into the beneficiary satisfaction survey. So based on action plan, we will ask ANM or we will do the corrective action regarding this. Now comes to the risk management framework as in place. So that I have shown the register itself. Risk and opportunity for improvement in all critical processes are identified, analyzed, and prioritized. So based on the risk identified, high, medium, low, you have to categorize, and it should be taken the corrective action. There is system in place to take action to eliminate and avoid, mitigate the risk. Let's suppose if any abscess is coming from subcenter A. So what we do in this case, if any abscess coming from a subcenter A, what we do in this case, we provide training to the ANM or we attach that ANM to the ANM which have good practices. We do that to avoid the risk and also mitigate the risk. And the lastly, there is a system in place to check effectiveness of the action taken. What are the effectiveness for this? So ANM capacity will improve and the chances of abscess will reduce. Many examples are there. So that's all about the risk register and framework. So this is the checklist for the immunization side.